Hi, Dr. Markbeaty here. Wanted to talk today a little bit about management of scars. Management of scars is an integral part of everything we do in facial plastic surgery. And during our surgical procedures, we of course place these intentionally and we're able to hide them quite well. When patients come to us with uncontrolled scars from, say, a laceration or abnormal wound healing, or having to have a lesion or a skin cancer removed, these can be much more challenging to rearrange and to correct. Fortunately, we have a lot of techniques that are very effective at minimizing the appearance of scars. It's important to understand that once a scar is there, it can't really be erased. So the goal is to effectively camouflage and minimize the appearance of scarring. So I'm going to show you a few examples here. We have examples of something called a geometric broken line closure, which is a very common way for us to correct unfavorably oriented or linear scars to make them less visible to the eye. The basic concept is if you take a line and break it up into an irregularly irregular pattern, it's very difficult for your eye to perceive that. Therefore, it camouflages the scar. And you can see from these results how beautifully these obvious scars blend in with the surrounding skin after this procedure is performed. This is an example of a patient who had a skin cancer removed from his nose, leaving an unsightly defect in the side of the nose. By designing and rearranging tissue to swing over and cover this defect in a strategic manner, you can essentially create a situation where not only the defect, but the incisional scar along which it's closed is completely invisible. And finally, here are some examples of patients who had abnormal scarring, hypertrophic or keloid scarring, which is something that we see commonly, particularly in some of our ethnic populations. These lesions can be removed and effectively reconstructed and restored to establish normal anatomy where there previously had been a grossly abnormal lesion. So one of the things that we do quite commonly as facial plastic surgeons is to manage the appearance of scarring. We have very effective methods for doing that. And if you have any of these problems, we'd be happy to see you at Beaty Facial Plastic Surgery.